Dear class, welcome back to State and Local Government. Let's talk about demographics. So why look at the demography of states and cities? So in this course, we will examine the evolution of state and local governments. We will rely on textbooks for historical development of the governments. We will also spend some time examining current state and local politics and programs. So there's a need to understand the demographics of states and local regions. What is demographics? So basically, we're interested in the distribution of people in a region by characteristics such as age, sex, or gender, size of household, race, ethnicity, marital status, religion, income, wealth, political party, technology use, education veteran status. These are just types of boxes that we have to fill in different places, right? When we apply for applications, they ask us all this information. Why do they collect all this information? It has to do with profiling, right? They want to understand the demographics of people that live in the area. Statistics. So demographic information tells us a lot about the population. Let's take a look at the following link. It's titled Resident Population of the US by Sex and Age as of July 1, 2022 in millions. So it's looking at millions of people in statista.com. Let's go there. So let me share this page. So as you open this page, these charts develop. These are the resident population of United States by sex and age as of July 1. So the light blue is male population, the dark is female. So as you see, I'm moving my hand to the blue one, the blue dot, and then the black dot, and the emphasis on the chart is changing. So let's look at what they're saying here. So they're saying under 5 years. So the vertical axis is age. It says in years. So how old are these people, right? So if you look under the 5-year age, you see that 9.46 million are male and about 9.05 are female. So you can see the distribution. And if you look to the side, actually, if you flip your head like 90 degrees, you can see that the population tends to be greater between the ages of 15 to 19, all the way to 60 to 64. And before that, we see a lower kind of population. And then after 64, we tend to see a reduction in the population. Wow. So the question arises, why is this sudden, sort of, we see lower and lower people. As we know, older people means people who are less able to survive illnesses, disease outbreaks. And so you might see that many people after 65 are either dying or moving to another state, right? And moving out of the US, rather. Maybe they are very tight on funding, they don't have too much retirement money, so they have moved to a country where they can retire, or maybe they just have died. Now, the younger population, let's look at it. It looks like they have below the age of 15, they have a few thousand, or rather a few million children. So they're going to need certain kind of services in the US, right? But it looks like the very young population is very low. And this has me asking many questions, right? So when you look at these charts, I want you to think about this. This chart is telling me that the school-going population, the K to 12 population, less than 19, right? These kids are a small section, but this is how many million? About 80 million people are under the age of 20. They probably go to some form of schooling, K to 12 or private schools, right? And so if this is how many people we have right now, you get an idea of how many schools we need, what kind of funding we need for public schools, things like that, right? And then the rest of them tend to be the working age population. But are they actually working or are they in college? Perhaps they're doing both. So these are things to think about. How much money should you allocate for higher education? How much money should the government allocate for creating jobs? So they have to think about that, right? And now with this elderly population, anybody above the age of, say, 50, you might be less and less less and less able to fight off viral infections and long-term illnesses, right? So there might be need for healthcare for these groups, right? And so we see a lot of elderly people, especially in this group, right? So in 20 years, these 40-year-olds are going to become 60. And so this group, this entire group here is going to become eligible for all kinds of um, Medicare needs, right? Medicare starts when you're in the retirement age. You'll start to see all kinds of Social Security and other kinds of checks coming to you as well when you retire, and you can use that money. So the government has to plan how many older people is it going to get in 2050, right? It has to know what number of people will retire, how many people will have funding, how many old people are going to need welfare services, daily visits by some health practitioners, other kinds of care providers. Otherwise, you'll see people are living in their homes, but they don't have any ability to function, and they're getting sick and they're getting hungry, and there's nobody there, right? So we have to make all kinds of policy decisions, and this is how we do it, right? We look at the demographics. Let's go back to our chart. So what did you see in the chart? What did it describe? Did anything make you think about policies? Look at it carefully and then write down something you noticed about the page. Brush up on the lectures in data analysis. So I will create a data analysis lecture for you later. Here's what I saw. I kind of discussed that to you, the concern with the rising elderly population and the need for schooling services. So every single state has to deal with these issues, right? And these are also issues that local governments have to deal with. So every time you look at a chart or table, ask yourself what information is inside it. Then write down what comes to your mind in a notebook or on your laptop. For this course, you will do some assignments where you interpret tables, graphs, and other kinds of information. What can we do with this information? Example, apply to analysis of policies. So you use data, you analyze it, you look at the data in different ways, and you get all kinds of information, right? So you might have a scenario where you have to apply that data. Example. So there's a bill proposed by Democrats in the state legislature of Arkansas to increase Medicare and Medicaid coverage to a wider population in Arkansas. And the Republican Party has generally opposed expanding the programs in many, many states. However, in Arkansas, they're kind of agreeing that they need some of this. the debate might be over how much to expand. Suppose you're working as an intern for a Republican candidate. What are some reasons for supporting or opposing the bill? So maybe you look at some data and find some reasons based on the data to support this bill. Facts. A small percentage of the US population have health insurance through their employers. During COVID, the Medicare and Medicaid programs were widely expanded in Arkansas to cover the general population with adequate health insurance, and it saved millions of lives. Most people of the state now want that coverage retained. So this is where the debate starts, right? So before COVID, Medicare and Medicaid applied to maybe the elderly population, but that was expanded not only for age, but also for different income groups. Some people were considered out of the poverty level, and they were considered not eligible for Medicaid, which gives money to lower income households. And so these benefits suddenly took care of people during COVID, and now those were being retracted. And so the Congress is basically trying to make sure that these services do not disappear for the expanded populations. So in some states like Texas, they're totally against it, against allowing the expanded population to have the coverage. But in Arkansas, they're coming through. So here there's places where you can apply the data to help the population of Arkansas. So there might be a Medicaid, Medicare assignment. Yes, we do have some work on healthcare, right? So you can check out this question, which goes over the same policy question, actually. What about the youngest populations? Let's take a look at some of them. So in this Wikipedia map, actually, you see the distribution of people below the age of 5. And you see the more dark this chart is here, you see the 9% or more areas, and the lighter it gets, you have less of the children. Here you see that many of these areas are gray, so there's light population here. But some of these areas in, say, California, you see the red. And then in some places, like in North Dakota, South Dakota, you see the red dots, which means a lot of children are living in those areas, right? Even in Alaska, you see some red areas. And then you think that the cities or the northern states where the population is generally high, you'd expect to see more kids there, and maybe there are dots. But I was surprised to find more people in some of these kinds of Midwest areas. But it's very interesting, so do check out these things. Let's go back to the chart very quickly. Questions. So did you see the bottom left corner of the page? So there's a list of the top 10 counties by percentage. Let's actually do that for 1 second because I forgot to. Here we have the bottom of the page. And if you click on it, it gets bigger. But there are some cities here. So if you go to the actual link here, which is the linked page, you can go there and I'll provide the link for the class. You can see the names here. Let's see if we can expand it here. We have an area called Castlevac in Arkansas. Arkansas. No, that's Alaska, sorry. Then you have Todd, South Dakota, Zybeck, South Dakota, Buffalo, South Dakota, Geary, Kansas, Northwest Arctic, Alaska, Hamlin, South Dakota, Chattahoochee, Georgia, Bethel, Alaska. So I never thought that the youngest populations will be in those areas, high density. There's also LA, Harris in Texas, Cook, Illinois, Maricopa, Arizona, San Diego, California, Kings, New York, Dallas, Texas, Orange, California, and Riverside, California. Very high populations of young people live here. So they should provide a lot of childcare. So in this area here, we see a lot of the like Hasselbeck. These are cities in Alaska. These areas have percentage-wise the highest percentages, meaning of all the people in Hasselbeck, 11.74% are children under the age of 5. However, this column shows top 10 in numbers. So as far as actual population, Los Angeles is number 1 for the number of kids under 5. It's 500,000. So this is what's going on here. So do take a look at this if you can. Let's go back to our sharing with the PowerPoint. So you see the assignment 1. Look at the assignments that you have. There's more information at federal government websites. Here are some links, which I'm not going to get into, but you can find them online. You can look for Medicaid.gov. You can look for Child Health Insurance Program, CHIP CHIP. That's available. You search online. Here's a CDC link, but you can find other links as well, which teach you about the programs. There's also Medicare. Look that up as well. So let's stop here because I'm not going to require you to do some of this work, but you can definitely search for those options. Okay, so I'll stop for today and see you in the next lecture.